Exercise 32 deals with the anatomy of the blood vessels. There are 3 layers of the blood vessels for both the arteries and the veins. Now the capillaries are only going to have 1 layer. That allows for that gas exchange and nutrient exchange to occur. The 3 layers, starting from the innermost layer, the tunica intima, the tunica media, and the tunica externa, then on the outside. The tunica media does contain the smooth muscles that are going to be involved with helping with constriction and dilation of the blood vessels. The blood pressure is much higher in the arteries than in the veins, so therefore that tunica media, that layer of the smooth muscle, will be thicker in arteries than it will be in the veins. So your arteries are going to be the blood vessels that are moving blood away from the heart. The veins are bringing the blood back to the heart, and the capillaries are the connecting points, and that's where the exchange occurs. As I said, you've got those 3 layers, the intima, media, and externa. As once again, you can see here how the blood would be flowing through. And on the cross-section of the histology slide, one way that you can distinguish between the arteries and the veins is because of the thicker muscle layer of the arteries. When you take a cross-section of it, the wall almost looks a little bit thicker, but the lumen is much more easier and it retains that more circular shape. Veins tend to have more of a collapsed look on them when there's no blood flowing through in your histology slide. So the nice rounded circle, oval shaped, it will be the artery, and the more collapsed one will be the vein. This is just showing a schematic flow chart of the blood flow coming from systemic circulation, reaching the heart. It's going to go to the right side. From the right side, it pumps through the pulmonary circulation to the lungs, becomes oxygenated, comes back to the left side of the heart, where it then is pumped to the systemic circulation. This is showing the pulmonary arterial system and pulmonary venous system. As the blood leaves the right side of the heart through the pulmonary trunk, and then it branches, you have your left pulmonary artery and your right pulmonary artery. As they go to both the right and the left lungs, you then have continued branching in the lungs until you get down to the pulmonary capillaries, which wrap around the alveoli, and that is where the gas exchange is going to occur. The concentration of carbon dioxide is higher in the blood than in the air sac at this point, so by diffusion it's going to go from high to low, and it goes out of the blood and into the air sac. When you have inhaled, the atmospheric air has higher oxygen levels, and so the oxygen is going to flow from that high concentration in the air sac into the lower concentration of the blood. When you exhale, you get rid of that CO2 waste. Meanwhile, the blood has moved on, is now oxygen rich, and goes back to the heart. This next section looks at some of the major arteries. Like I said, it is moving the blood away from the heart. And this has the major ones labeled as you look through some of them, starting with the head. You've got the internal carotid artery, the external carotid artery. Those branch off from that common carotid artery as it moves and branches off from the brachiocephalic trunk. You have the superficial temporal artery. A lot of these are going to be named from the area or the body region of where they are located. The brachiocephalic artery is going to be servicing the right arm and the right side of the neck and the head. The common carotid artery is going to be servicing the head and the neck. The internal carotid artery that branches off from it services the brain and the eye. The external carotid artery is going to be servicing the face and the scalp. Your superficial temporal artery will service the superficial temporal area of the scalp and the pulse. Here you have highlighted the vertebral artery, axillary artery, brachial artery, radial and ulnar arteries, as well as the right subclavian artery. So the right subclavian artery is going to branch and serve the right brachial artery to service the arm. The right radial artery is on the lateral forearm. The right ulnar artery is on the medial forearm. So a lot of these you can see will be servicing or named by the area that they service. That's why it was so important at the beginning of A&P that you learn those regional areas of the body. The right vertebral artery is going to serve the brain and the spinal cord. The best way for learning your arteries and your veins is going to be just by practice. I recommend that you get an unlabeled drawing, diagram, and then just label, put it in a plastic sleeve and label it, use a marker and then wipe it free, relabel, and just keep practicing. Here in the brain you can see where the internal carotid artery comes, and you have what is known as the circle of Willis, the cerebral arterial circle. This allows for, if there is blockage in an area, that you will still get blood supply, being that the brain is so critical in its function. This is now showing in the abdominal cavity. As you can see below the diaphragm there, the left gastric artery feeding the stomach area, that you've got the splenic artery, the celiac trunk, and the common hepatic artery. The celiac trunk is going to be servicing your upper abdominal areas. The gastric artery supplies the stomach and the esophagus. The splenic artery supplies the spleen, stomach, and pancreas. And the common hepatic artery is going to supply the liver, part of the stomach, the gallbladder, and the pancreas, and part of the small intestines, the duodenum area. In terms of the superior mesenteric, that's servicing the pancreas, small intestines, the appendix, the first 2/3 of the large intestines. The renal arteries are supplying the kidneys. The inferior mesenteric is the last third of the large intestines. Then here you can see the major arteries from an anterior view of the lower limbs. The common iliac artery will supply the pelvis and the lower limbs. The deep femoral artery, the thigh muscle. The femoral artery, the thigh and the hip. The popliteal artery is the knee. You have your anterior tibial artery, which is the anterior part of the lower leg. The posterior tibia artery supplies the posterior of the lower leg. And the dorsalis pedialis artery, ankle, and foot. Your veins are often going to be named as the corresponding of what the artery was, but some of your more superficial ones will have a different name. So in this diagram, it is identifying the veins of the head and neck. The brachiocephalic vein is draining blood from the head and the upper limbs. The internal jugular vein from the brain and the face. The vertebral vein from the brain and the spinal cord, the external jugular vein from the superficial face, neck, and scalp, and the subclavian from the upper extremities. From your upper limbs, the upper limbs, you've got the axillary vein that's draining from the shoulder. The brachial is from the arm. The radial vein from the lateral portion of the forearm. The ulnar vein is from the medial side of the forearm. The cephalic vein is from the superficial area of the hand, superlateral forearm, superficial arm. The basilic vein, superficial medial forearm, superficial arm. The medial cuboidal vein is superficial cubital fossa area. Now you're seeing the veins that are involved with the inferior vena cava are going to drain into that. Your hepatic vein is draining from the liver. The renal veins draining from the kidney. The common iliac veins are from the pelvis and the lower extremities, and like I say, those are going to drain into the inferior vena cava. The hepatic sinusoids are draining the capillaries of the liver. The hepatic portal vein is going to be draining from your digestive organs, picking up those nutrients that were absorbed from digestion. The gastric veins drain from the stomach. The superior mesenteric vein is the small intestines and about the first half of the large intestines. The splenic vein is going to be draining the spleen, the stomach, and pancreas. The inferior mesenteric vein is going to be draining the second half of the large intestines. And then here's the view of the lower limb. You have your internal iliac veins, which is draining the pelvis area. The external iliac veins are draining the lower extremities. The femoral veins also draining those lower extremities, and they will drain into the external iliac. Your great saphenous vein is going to drain the medial side of the foot, the leg, the knee, and the thigh, and the popliteal vein is draining the knee. What are some clinical manifestations that you can see associated with blood vessels? Arteriosclerosis is accumulation of fatty deposits that will build up in that innermost layer along the tunica intima of the arteries. So as the blood is flowing there, it gets deposited, you get that plaque buildup. And this can interfere with the blood flow. It can ultimately also cause damage to the tunica media, the smooth muscle that's involved with controlling the diameter of that lumen to control the amount of blood flow. And so it ultimately reduces the blood flow. Coronary artery disease is when this is affecting the coronary arteries. Remember, those that are feeding the heart itself. A stroke is when you have damage to arteries and it interferes and interrupts blood flow to the brain. Varicose veins is when the veins have valves in them and those valves are not working properly, and it interferes with returning the blood back towards the heart. What happens is the blood starts to backflow and then it becomes kind of stagnant and pools there. The vessel dilates to handle that increased volume. There are several factors that play a role in this. Part of it is genetics. Pregnancy can play a role. Anytime you're on your feet for long periods of time with little movement, it can increase the risk factors for that. Hemorrhoids are simply these varicose veins or varicosities in the veins of the anus. Venipuncture, this is when you are drawing blood or injecting into a superficial vein. You use the veins because the pressure is less there. Coronary bypass operation, you typically will take a piece of the great saphenous vein and then graft that around to bypass where there's a blockage in a coronary artery. So now it allows the blood flow to go around that obstruction area.